From CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning and welcome to Facing South Florida. This week I spoke to Jackson CEO Carlos Migoya, who revealed to me that 1 out of every 5 Jackson employees who have been tested this month are now positive for COVID-19. But the testing has been limited. So I start by asking him if he should be doing more testing in the hospital.
Frankly, we don't have enough tests to test every one of our employees and what's going on with the reagents and so forth. But we have enough tests to deal with the people that are either asymptomatic or have actually impacted with asymptomatic, as well as all the patients that are walking in the door, as well as all the patients that are going into the emergency room.
Well, and I think you just hit on it. I think you just said it. If you had the reagents, if you had the testing capacity, you would probably be doing more widespread testing. I'm not saying it's a failure on your part that you don't have the reagents, but when we hear that there is adequate testing and the testing system is great and everything about testing is fine, the reality is you do not have the chemicals, the reagents necessary to do the type of testing you would probably want to do on a wider scale basis for your employees. Am I wrong?
So not just the employees. Let's talk about testing, okay? Because you're obviously hitting on a point. When we started this thing back in April and May, from a community perspective, we were doing maybe 2,000 tests a day. Now we're doing between 8,000 and 9,000 tests a day, and it's still not enough. We are 2.8 million people in Miami-Dade County, plus whatever number is in Broward. I don't know what it is, 1.5 or 2 million people in Broward. I'm not familiar as much with the population of Broward. But the bottom line is, we believe that between 25, there's studies that say 25% of the people could possibly have or have had COVID. There's a possible chance that that's the case. That's over 500,000 people that either have it or have had it. Are you immune from it? I don't know. I had it. I think, it doesn't mean I've been immune. So I'm still very careful using the mask and the social distancing, as well as everybody should. So the issue is with our employees as well as anyone else, when you're in the community, you're exposed to the same situation. So everyone needs to be careful with that. And are we going to get enough testing to test 2.8 million people in Miami-Dade County? I don't think that'll ever be the case. We're trying to every way possible, and today nationally, because you have so many states whose numbers are growing, everybody wants to be tested. And there's more and more people needing tests. So we do our own internal testing, which means we need reagents. Most of these other places go to outside parties, third-party labs that are going nationally, and that's why there's a delay, because there's so many people that needed to be tested. Even though testing is important, Jim, we're not going to get enough testing. So therefore, the assumptions that everyone has COVID and being social distancing and masking is the most important message we can get to everybody in the community, including our own employees.
And I completely agree with that. The reason I'm posing these questions to you, though, are you are the CEO and head of the largest health system in South Florida, and so that's your area of responsibility. You're absolutely right about people in general need to be more proactive. I'm just asking about the folks that you have some say and control over. And last point I'll just make about testing is you could also institute a pool system where, if you don't have enough reagents to test individuals, maybe you test 20 or 30 employees at a time in a pool like you used to do with HIV testing in the clinics back in the day, and then you can sort of get a sense for where we're at. I think until we know where we're at, we don't know the problem we're facing.
The fallacy with that, Jim, if I test you today, you're negative, doesn't mean you're not positive. You could be positive and not have enough virus in your system that hasn't tested positive, and you might test positive tomorrow. The only way you're assured that everybody is negative, to test them every day, every one of the people. Testing 20 people a day does not solve the problem.
So then the question becomes, why do any testing? If you adopt that belief, then testing is irrelevant. The reason is to try to find people and isolate them and do contact tracing. So testing has merit.
I think testing is valuable. I totally believe testing is valuable. You need to understand what percentage of your population have had it or have it. And I think that part is important. But I think beyond that, we're not going to ever have enough testing to what we need to be doing. I mean, if you look at this herd idea, which is impossible to do, it's 60-70% of the population having had it. It's very impossible to do. So it's important to continue to make sure that people believe that they all have it and are social distance and masking. I can't say that enough.
Carlos, I don't want you to think that I'm trying to put you on the hot spot with regard to this. It's just Jackson is such a vital part of this community. You know that. You've been leading it for 10 years. You've helped rescue it financially. I can't even imagine where we're going to be financially when all this is said and done. That's another conversation to have. But I just want to stay focused on what you're dealing with there, because I do think that until leaders like yourself and others, and I'm not saying you haven't been candid, but until you sort of paint the picture of what the problem is that we've got, people can tend to become lax and not take it as seriously as they should. And that's why one of the reasons why I was raising
But that is part of the entire community. I will tell you right now that just about every patient that we get in the door that goes through the emergency room that does not need to be hospitalized, we're doing the testing from a third party, not from within, because we don't even have enough testing internally. We can do about 500 tests a day. That's all we can do from our own lab standpoint. Anything beyond that, we're using third party. So we're prioritizing from a needs perspective. Anybody that needs to be hospitalized, we absolutely have to have them tested immediately, because we need to understand the level of care that they need. And by the way, of those people that are walking in the door that are positive COVID, 40% of them are coming for a different diagnosis. They didn't even know they had COVID. So they either had no symptoms or mild symptoms. But when they come in, you still have to treat them the same, because you have to isolate them. You have to be able to have the PPE and make sure that those people are not infecting other patients or employees. What
is the current status of Remdesivir, your allotment of it, your supply of it? Do you have it? When will it be coming in? I realize it's sort of controlled by the federal government and controlled by the state. So where do we stand right now with this drug, which is by many accounts seen as the best effective treatment for COVID-19?
So let's talk about that, because that's important. So Remdesivir, there's a very limited supply of Remdesivir. And frankly, when you talk about Remdesivir, we're only really providing Remdesivir to patients at a certain level when they're in intensive care. It doesn't come, we can't do it prophylactically. We can't do it for people in med-surg. It's only for specific people. And we're doing it only to basically a handful of people. It's not a huge number of people. And frankly, even with that number of people, we have a very short supply. Right now, the supplies are no longer going directly from the federal government. They're coming directly from the manufacturer. There's still certain controls on that. And now I'm reading, from what I've read nationally, the United States is taking control of all the supplies for the next 3 months, which they're saying it's 500,000 of them, which is wonderful, except only 100,000 of that will happen in the first month, and 200,000 will happen in the second and third month. So if you look at 100,000 for the entire country, it's not a lot of these. So the Remdesivir is not the answer to all of this. We don't have enough supply, and I'm not sure, even with the 500,000 that we're talking about over the next 3 months, that will be enough supply for all the hospitals in the United States and all the patients that need it.
Are ventilators an issue, not just today, but as you project out in terms of worst case scenarios? Do you have the ventilators that you need? Because I know in Houston, we're seeing stories of some hospitals running short and doctors having to make decisions about who to place on a ventilator and who not. Are we close to that at all in Jackson?
So we're using more ventilators than we did before. The percentage of ventilators have continued to be on the low side, and we're comfortable for the moment that we have enough ventilators. Remember that besides the regular ventilators that we have, we've also acquired back in April a group of portable ventilators that are usable one time for patients that we haven't even touched. There's several hundreds of those. In addition to that, we have anesthesia machines in the operating rooms that came down and shut it down. So we have plan Bs and Cs and Ds in this environment. The best part of, if there's a silver lining in this very dark cloud that we're under today, is the fact that our intensive care physicians have learned a lot from the experiences in New York, and they're ventilating these patients later. Now we're seeing very acute patients, so they need those ventilations, but they're going later, and because of that, we're receiving much better outcomes than they did in New York.
All right, now let's talk broader message that you've been wanting to sort of talk about, that you've raised several times. Look,
thank you.
You're Carlos, again, I ask you tough questions because I know that you're someone who can handle tough questions, but again, let's go to the larger issue. You're on the front lines, you're seeing what's happening, you're seeing the stress that it puts on your employees, the nurses, the doctors, the residents, the folks that you have in your system. Talk to me about what message do you want to give the public who maybe is just tired of staying at home and they don't really want to wear a mask and they want to go out and they're tired of all this? What do you say to them?
So here's the issue. I'm tired of wearing a mask, okay? I want to hug my family. I want to hug my friends. I'm a hugger. And I want to be able to do these things. And it's been over 100 days since we have done this. But there's a complete disrespect out there in the community, in all Miami, in all South Florida, frankly, most of the country, of people not being social distance and not wearing a mask. That is, as long as those continue to happen and more people continue to get this disease, and of course some small percentage, but still major percentage of the people get hospitalized, it'll get to a point that we don't have enough hospital beds in the entire South Florida to manage what's going to happen in our community. So the best way to keep, if you want to worry about the bed size and the number of staff and all those things, the best way to keep that down is by managing the infection from a community-wide perspective. The most important message we got to give the people is wear your mask and be socially distant.
When we come back, Miami-Dade County Commissioner Xavier Suarez.